Okay, so how many people here have insurance coverage, including Medicare? Okay, guess what? I don't.
So buy it.
You know what? That's what I would like to do, but I can't afford $30 a day to pay for it. And that's what it is when you're an individual.
You get free?
I stay healthy. Now, all this talks about socialism, you people just don't know what the word means, because the word social means society. And what you are complaining against is that you just don't like society, or you just don't like some people that are in society to have the same rights and privileges that you do.
No, socialism is
Every other industrialized modern nation has health coverage for their citizens, but not the United States.
They're bankrupt.
And guess how many, there are 10 nations that are immensely healthier than the United States. Iceland, Sweden, Finland, Denmark, Germany, Australia, Austria, Canada. They can afford to do it. They can afford to pay for their citizens. They can afford to do it, and they are healthier, and they are more prosperous. Now, do some of them have problems? Sure. I don't say that we copy a single plan. I say that we look at all of the plans, and then we pick out what is the best. Because we can do it. We've done these things before. You people are saying, oh, it's impossible to do this. We just can't afford it. Oh, we're weaklings. We can't do it. I say, we can.
The issue that I want to discuss tonight is, if you ask in the last 20 years, why has your health costs gone up so high? And you ask one simple question that I've been asked, I haven't found the answer, maybe somebody has it. There are close to, they say 11 million illegals. That is so far from the number, I can guarantee you there's probably triple that. And you take those illegal aliens that get free coverage, you take their kids who become citizens, they get free coverage now because they're a part of them. And you add these costs over the last 20 years to what the taxpayers of America pay, and you add that to the cost, find out what the cost in the last 20 years, any percentage-wise, has increased the number, increase in health care. Nobody wants to talk about the illegals because it's a sore subject. But you tell me that there's 11 million in this country, I guarantee you there's a lot more. And why should everybody who is a citizen, it's a law. Which laws are we going to follow? The illegal laws, illegal aliens, or do we just turn our head? So one day we're going to have to figure out the cost of mental health care is so high, I predict that this is one of the main reasons it's so costly. And we shouldn't be able to have to follow the laws, and some people don't. It's that simple.
Good evening, ladies and gentlemen. My name is Robert Scalise, and I've been a resident in San Luis Obispo County since 1954. So I'm a relative newcomer here. There's one thing I'd like to plead with the group, is that one of my mottos and main mottos is, let respect be mutual. Many of us are going to come up and say different things that different groups of people disagree with, and it's just only common courtesy. It's not to yell out or scream out at the individual and to try to shout them down. We're here to listen and to indulge in a dialogue and to have people express their opinions. And I think it's a good idea to just let respect be mutual. And we can clap and wave our signs. Let's try it that way. Let's not be like some of those ruling moms on TV. Please. I'm here primarily to discuss HR 3220, 3200, right. You know, it was written long ago that things in print must stand and fall by their own worth or the reader's fancy. But there being nothing more to be desired for truth than a fair, unprejudiced hearing. And that's what we're here to discuss tonight, the hearing. Now, there's many people here that are for national health care, and there's many people that are here against it. I'm here to discuss the issues here that's written, that was voted on by the House, by our representative Lois Capps, had voted for. I tried to get in touch with her, and to no avail. She just seems to be unresponsive to me, and from what I hear from many other people. I wrote a letter to the Tribune, which they failed to print, and it stated our representative Lois Capps has chosen to make a written statement defending her vote for HR 3200, the health care reform bill, on August 13th, where she stated, "I'd like to put to rest some of the rumors circulating about the reform." She goes on to say, we're running out of time, but anyhow, she said, "Our bill does not cover people who are in this country illegally and specifically prohibits federal funding to provide undocumented people with health coverage. There is nothing stated in this bill that says that. And it's all left up to interpretation." One last final thing. To that lady who is suffering from cancer, there's a term called quality adjusted remaining years that will determine the amount of health care that you will be getting under this provision. It's in the book.
I have read the bill very carefully.
My name is Jim Mallett, San Luis Obispo. I would like to start by saying that it's my belief that in what we can all agree is the greatest, wealthiest, most egalitarian country in the world, we can afford to figure out a way to extend health care to everyone in this country. That's something that I think that the system as it exists now is broken, beyond repair. There's no way that we can sustain this system the way that it is. It drives people into bankruptcy constantly. If there's an argument made that we don't want to have government rationing, if you don't think that we don't have rationing as it is now, talk to some of the people who get denied care, who have their coverage rescinded from them, who, for whatever reason, lose their coverage or are denied valued care that they need. Somebody was saying, people have been trying to get in touch with the Congresswoman Capps. I'm not sure if everybody here expects that they would get a personal meeting with her or not, but I've called her office and talked to her representatives and her people several times about issues. The bill that they have passed, and this is a document produced by the Committee on Energy and Commerce, on which Lois Capps sits. If this bill passes, 4,100 senior citizens will have the donut hole in Medicare Part D eliminated for them. 350 families went bankrupt due to medical catastrophe in this county last year. That would be done away with if this passes. There are 148,000 uninsured individuals in the county of San Luis Obispo who would be covered if we pass the public option. I would encourage everybody to support this legislation for the benefit of everyone in the county.